Good afternoon, and welcome to this webinar on generative AI. And we're going to be sharing today some of our case studies that we've collated as a result of the work that we've been doing on development of generative AI principles. I am Ruth Patterson. I just mentioned that at the start. I am Associate Professor in the School of Health and Social Care at Edinburgh Napier University and Head of Nursing. And I'm Chair of the Innovation and Pedagogy Group. And just to give you a little bit of context about this piece of work that we've been doing in the Innovation and Pedagogy Group, we were asked by the Chief Executive to look at some of the work around artificial intelligence and development of principles that some of our members could use, or all of our members could use, to support their development and delivery of AI in healthcare education. We're in the middle of that work at the moment. That's gone out to consultation, and we've asked our members to send us in some of the case studies and share some of their good practice in relation to artificial intelligence. And we've got 4 of those case studies this afternoon, and 4 of our members presenting today. We've got Oxford Brookes University and Emma Mellors, who's going to be presenting on their work. And we have got Northumbria University, Aston University and King's College University. They're going to do a short 5-minute presentation just outlining the work that they're doing, followed by questions and answers. If you have any questions or questions that you want to post in the chat, please do just post them in the chat, and we'll address those after each of the presentations. So without further ado, I'd like to introduce Emma Mellors, who is a senior lecturer in the Faculty of Health Science and Technology at Oxford Brookes University. So I will hand you over to Emma. Thank you.
Thank you, Ruth. I'm delighted to be here today to share a case study from Oxford Brookes University. So hello, I'm Emma Mellors. And the case study I'm going to show you is going to illustrate the education principle. And it's the example I'm using is using Copilot as an article reading assistant. I've got a few slides here, and I'm going to show you a practical example. Okay, so the objective of this activity really is to support learners, first and foremost, in building confidence and skill, but it's also to do the same for staff. So this is helpful for all of those people, because it's a quick and effective method to make research more accessible, to encourage engagement with the literature, and to more easily critique and apply research to practice. So I'll give you a bit of background to this activity, and then I'll show you a demonstration. So in terms of background, this case study is from an online CPD module that we run as part of our Advanced and Specialist Practice program. It's called Advancing Clinical Decision Making. And the context of this particular example I'm going to show you is how we were exploring ethical decision making, and we were looking at using AI as part of this. So it sat really nicely there. And learners were struggling to understand and apply the findings of particular research articles, and I'm going to focus on one particular one today. The activity itself, so it is where learners followed an example of how to use AI as a reading assistant using a prompt sheet alongside the live demonstration in class. So the best way to show you this is really to show you the practical application. So I'm going to show you a 2-minute demo video, and this uses a prompt sheet, and here it is. This is an example prompt sheet that can be used alongside this in-class activity. At the top, it's important to signpost clearly to the learner how to access the article in question, how to access it as a PDF option so they can be uploaded to the AI tool, and signpost to the AI tool and how to access that. Then it's the prompts that are really important. So prompts are effectively the questions that are going to be asked of the AI tool. The more specific they can be, the more useful the output. And we're going to do this in 3 levels, so 3 prompts today. So I can just copy and paste very easily from this prompt sheet. I'll go to the AI tool now, so Copilot. You can see the article's already uploaded, and I can paste my prompt underneath. Just to note that I am logged in through my academic profile for optimal data protection. And this prompt, this first one, is really about accessing an easy to understand summary of the article. So it's about accessibility. And quickly, the AI tool brings us back that, breaking it down to methodology, findings, and meaning. It offers questions as to how we could further interrogate the information here. If we go back to the prompt sheet, there are signposts here to get the learner to think about their understanding at this point and to go and contextualize that back in the original article. Going on to prompt 2, this is really about delving into the detail. And this is a question that is always posed that challenge learners when looking at this article in particular. And so this helps break down the methodology, which is very technically challenging. And it does it in a way that is easy to understand. And through reading this, learners are able to more critically understand and interpret the findings, and then that aids application to practice. Thirdly, the third prompt, and the last one we're going to use, is about putting criticality at the center of this inquiry. This is going to ask the AI tool to be critical of itself. So can we trust the interpretation? And to ask for a practical way to cross-check the information that's been given to the original article. And it does this in a very practical way. And it also highlights the importance of being critical in this way. Okay, thanks for watching that. So that's probably the best way to see that in practice. And now let me talk to you about the impact and learnings of this case study. So for learners, there was certainly better understanding of the article, and that was kind of the immediate effect. There was also a greater willingness to engage with the detail critically of these articles, and then to think about how they can be, realistically applied to practice. This built skills not only for thinking about this particular article, but for other material on the reading list. And so what we saw throughout the course of the module was significant growth in confidence to experiment with the use of these tools, and actually more transparency in critically discussing them with each other in the course. And so a statement from a learner: this is the first time I've used AI, it was so helpful, why didn't someone tell me about it earlier? And so it really showed there was a hunger from learners to want to be shown how to effectively use these tools and to be transparent and guided by the tutors. However, there of course were challenges. So not everyone was wanting to dive in so quickly. There was of course hesitance from some learners who had not previously used such tools, and they were skeptical, and we needed to encourage that healthy skepticism. There was also an issue with lack of staff confidence for upskilling others. That was kind of important, the other side of it, to take into account. So just final slide here, thinking about future application. Recommendations-wise, if you're going to do this kind of activity, it's really important to cater for diverse confidence levels for the learners. So giving options of this in-class activity. They can watch as the tutor does it. They can follow along, or they can even contribute to how we're questioning the AI and what to ask it next. The prompt sheet is quite an important part of this activity. So giving step-by-step instructions, make it really accessible, make it easy to actually do for both the learner and staff. And of course, staff will need guidance, training and time to practice in order to upskill learners in this activity. And going forward, we actually have now this module, Advancing Clinical Decision Making, has become a compulsory part of our first year of the MSc Advanced Clinical Practice. So that presents us with an opportunity at Brooks to ensure we embed this activity, and so it can upskill all learners equitably in their first year in using AI tools for their program ahead. Thank you for listening. If you've got any questions, I'd be willing to take them. Please do get in contact, and I can supply these resources and slides so you can use them as well.
Thank you, Emma. Really interesting. I've got quite a few questions, but I just wondered if anybody in our audience has got any questions. First of all, I'll just give people a few minutes just to pop any questions in the chat, or a few seconds just to pop any questions in the chat, if that's okay. And then if there aren't any, I might just kick off the discussion. Any questions from the audience?
Hi Ruth, we've got one in the Q&A, one from Melanie Rogers saying, are you finding more students are using AI in assessment?
I mean, at Brooks, we're embracing the kind of use of it within assessment and trying to do that in a critical way. So trying to give learners skills to embed it, so it's part of assessment as well. So we're aware of the ways in which you can use AI to shortcut, thinking. If we're doing that in a really transparent way, we're working with learners to say, look, these are the tools, you're going to use them, and you should be. If we're not upskilling you, then you're going to be left behind too. So how do we do that together?
Thank you. The question, I think the chat's now been enabled, so there's quite a few questions coming through. I've got a question from Melanie. Now, where are we? They keep on jumping around. From Melanie, is that right? Is that gone somewhere else?
Sorry, yeah, we just answered that one.
Sorry. Wendy Vassallo has asked, how do you ask them to reference such use of source?
Okay, so the article itself obviously has its own reference, so that would be the article. They're just using it to help interpret and access the information, to really kind of help get a breakdown of it. But of course, if they're using AI just to ask it a question without uploading a PDF, so they're specifically talking about one article, you can't reference AI in that way, but you might ask it to give you references to where it's getting this information from. So if you ask it a question, ask it for where it's getting the information from, and then you can cross-check those references with that information.
Okay, thanks. Heaven got a question saying that this is a really interesting piece of work that you're doing, and is it only open access resources that you access on this Copilot?
At the moment, recommendation is not to give the AI tools anything it wouldn't be able to access openly through the web. So anything that's got an open padlock as an article that you find you recommended wise, that's best practice at the moment.
Okay, excellent. Neve Skelly has asked, how do you navigate the conversations with students that copying and pasting content from AI, such as an easy read summary into an assignment, is plagiarism, as at present we are helpless to actually detect them doing that?
Yeah, I mean, in a way, if they're doing that, they're probably not getting to the critical understanding of it and the application. So I suppose the assignments are trying to get at critical thinking, aren't they? Everyone could, take information and copy paste it, but if the questions are being asked around your understanding, your application, your critique of those things, then they can't really just copy paste stuff. They need to engage with the material. Even the prompts that we have to ask in terms of using this as a reading assistant, we have to know what we want to find out. So actually it's asking for engagement, and probably a level of engagement that actually people don't understand the article in the first place, they wouldn't do. So actually this is a way to get deeper into it and become more critical in the detail.
Thanks, Emma. And this one is linked to a question that I had, which is Louista's and linked to Neve's as well, about what linkage has this? This isn't actually their assessment. This is a preparatory piece of work for their assessment. Is that right?
Yes, I mean they will use these articles and they will talk about them in their assignment. Yes. So we kind of almost need them to be able to really access the information, to put it in and understand it and apply it in their assignments.
Okay, great. Emma, I wonder whether you'd mind just popping your email into the chat, just because somebody's just said it's just bounced back. So people are emailing you already about this.
Oh, brilliant.
So that's great. So an anonymous attendee had said, I wonder what your assessment policy was regarding AI and assessments and using paper analysis from Copilot, and how this works with AI similarity checks. I suppose that's talking a little bit about the plagiarism side of things, and how do you ensure that the student's work is absolutely authentic?
Yeah, and I think part of that is building the trust and transparency and working with them and showing how to use it effectively and critically. Of course, you can't yet check that stuff in Turnitin, but you can see when people are thinking critically and how the tone changes in their work if that's not their voice. So it's about, I think, inevitably trusting learners, but giving them the tools and effectively working with them and upskilling them. And I think then they want to learn. I mean, if they're there to learn, they want to be upskilled and they want to get the most from this learning.
Mm-hmm. Absolutely. And one last question before we move on is, do you find that students' answers change as the large language models adjusts or gets used to the questions and responds to feedback? So, for example, is the answer different the next time that article is uploaded?
Absolutely. And that's the really interesting thing about using this tool. Every time I would do that, it'll be a different answer, but there'll be broadly similar information. So that's why it's really interesting. When you do it as an in-class activity, everyone gets a slightly different bit of information. So that sharing is a very interesting process.
Great. Thank you, Emma. I'm sure, we could spend an hour talking about this. That's been absolutely fascinating. So thank you. I'll maybe pick up Bill's question at the end of the session. Bill's asked about boundaries, and I think, that probably might apply to a lot of the areas of AI that we're going to be look at. So what I'll do is I'll ask that one right at the end about boundaries. Thanks, Bill. I'm going to hand over to Mary Bell and Sarah Stevenson. Mary Bell is an assistant professor and midwifery admissions lead at Northumbria, and she is joined by her colleague Sarah Stevenson, who's also an assistant professor in midwifery at Northumbria University, and they're going to come and showcase their AI case study.
Excellent. I hope you can hear me. So I'm going to kick off and I'm just going to explain some of our journey about why we decided to use an AI generated information for a trigger prompt for midwifery care planning. So our history of this is that we needed to revamp a 1,000-word case study assessment because the students were not performing well in it due to not actually demonstrating application and analysis at level 5. And they weren't able to articulate the role of the midwife. So what we realised is that actually students were probably already putting assessment information into a search engine and using some of that in their responses. And what that meant was the output was really descriptive. So they just weren't meeting the learning outcomes for their module. Like many other of the modules, and I think this is probably shared across academic practice, is that students, particularly those who had a student accessibility plan, were being guided to use AI anyway. So we were starting to see a number of assessments that were flagging with our AI indicator tool and spending quite a lot of time considering potential academic misconduct. So I don't think we'll say any more about that because I think that's really common to many of us. So one of the things we started to do to try and get students to move on in this journey of application and analysis was actually use what we call a thinking tool, but it's basically a table which asks students to question a scenario, for example. So one of the scenarios that we used in class was Amy. I hope Amy is going to talk to us.
I would not recommend having a hangover when you're pregnant. I've literally only just got out of bed, so I thought I'd have a hair of the dog just to make myself feel a bit better.
So obviously that is not something as midwives we would be recommending, but that is what's out there and what women and student midwives are seeing. So we were wanting the students to imagine that Amy was a case study and to get them to think about what was the care need, why was it important, what was the pathway that a midwife would signpost and care for this woman on, etc. So that went quite a long way. We did find that the students were recognising they needed to find evidence to inform their answer. Again, they were still really reliant on search engine findings. So we wanted to move them away from the search engine found and then sort of repeating that back to us. So we needed to find an approach where actually AI was a tool for them, but not the whole answer. So, can we come to the next one? Yeah, great, thank you. So as we went on this journey, we had 2 aha moments, and it took 2 to get ourselves into this place. So The first one was actually a colleague who'd left the university and gone to work in a really senior role in clinical practice. And in conversation with that individual, once they picked up that role, we were talking about students complaining to us that they didn't need to be able to do database searching, they didn't need to be able to write a dissertation to be an excellent midwife. And our colleague said, well, that's fair enough, isn't it? Because AI is going to do everything for them when they're qualified anyway. And that was a real point where we thought, oh my goodness, wow, we hadn't really thought about that. And our other aha moment was actually from our interview process. So part of the reason I introduced myself as being admissions lead is we had a question in our admissions interview questions around how would midwifery defend the use of humans in maternity care in 2050? So this was helping people tell us about the role of advocacy in midwifery care and maternity care practice, and get students to recognise that humans demonstrate empathy and women want humans, particularly when women want things that maybe algorithms don't suggest are suitable or available. So care with outside of maternity care usual guidance. And the third thing that occurred to us was that actually women are already doing this. They're popping something into a search engine, they're finding out information, and they're bringing it to their midwife and saying, I found this. What does it mean? What do you think? Is this important for me to know or respond to? So it was everywhere already. We just needed to maybe think about getting students to look at what was being found and triangulate it. So this is one of the prompts that we used. So we put a question into an easily available search engine and asked it about mpox and pregnancy. This is what came up. And at the very bottom of the tablet image, you can see this is for informational purposes only, for medical diagnosis and advice. Consult a professional. So there was a few things here that we did. We gave the students the textual prompt. On the right-hand side of the screen, we gave them a little bit more information to sort of make it a bit more like this was a live individual coming to them and having a conversation, and to remind them that as the midwife, you are the professional that the pregnant woman is going to seek that medical advice from. And just a little reminder, we asked them to tell us how they were going to respond to that advice. So that became the prompt for their sort of case report. What is your midwifery advice? What do you need to do? And what evidence is informing your response? So when we're thinking about, does it work? One of the first questions is it authentic? I think the reality is that students are doing this, women are doing this, and it's about developing those skills around triangulation and checking it. Is it inclusive? Yes, I think it is inclusive. We have a range of prompts for students. Some of them are very textual based, some of them are video with a bit of text that's generated by AI. It's inclusive from the perspective that midwives don't get to choose who they care for. So when women come through the door, the midwife has to care for and meet the needs that come with that individual. So there isn't a choice around that. So we're thinking about the diversity of women's needs, and those women might actually not have control of the circumstances they find themselves in. So in terms of being collaborative, yes, absolutely it is, because midwives and women will often journey together, particularly around an emerging issue, for example, mpox in pregnancy. Not very common in the UK, becoming more common in different parts of the world. So is it improving analysis and application? So the weighting of our rubric is 50% knowledge, 30% application, and 20% analysis. So we can see, Sarah and I both mark this assignment, that definitely the analysis and the application is coming. It's definitely developing. Our external examiner loved the idea of this assessment design. One more time. And I've had a little bit of a look at some of the data, so it might be not terribly easy to see, but the left-hand bar is the lowest grade bandwidth for our students. So you can see across the 3 years, we've had students select a case study in 22 and 23, and AI prompted case study in 24. So the left-hand bar suggests that about the same number of students just don't manage to meet the assessment. And that, we think, is probably to do with assessment literacy. So for our newer curriculum, we're spending quite a lot of level 4 first year study developing assessment literacy for the students. About the same number in every year are around that threshold of 40 to 49. What's really interesting as we're moving into the AI prompted case study, where we look at the grade bandwidths to the right of those charts in 23 and 24. In 24, we've had the AI prompted case study. We're starting to see a shift around higher or greater number of students in those higher grade bandwidths. So therefore, we do believe that it is improving analysis and application, because that's the bit of the mark that appears to be changing most following this. And just finally, from our external examiner, there is definitely clarity and preparation in respect of enabling the students to develop their analysis and application skills in response to this prompt. Yeah, so we're done. So questions? Whistle stop.
Thank you both for that presentation, and you know, what a different way to sort of get the students to think about critical thinking using AI. Kevin has got a comment, and he is talking about, I think the question around assessment for professional programmes should be, if a robot can pass your assessments, are the assessments fit for purpose? And that is something which we have really grappled with our discussions with professional regulators. And he's got a statement which says, I think that we as educators should be looking towards authentic assessments, as there will be an expectation from employers that graduates to be digitally literate, including proficient in AI use. And I think that's right, but I think I would like to add to that is that they're able to verify that the information that patients are getting from AI is authentic and legitimate as well. And how do we get our students to verify that as well? And I suppose it's just about, you know, is there anything that you want to say about that in terms of, you know, the digital literacy that this is potentially harnessed or disabled or whatever?
Yeah, absolutely. No, I couldn't agree more really with that statement around the necessity to have a human in the picture really in our professional courses is absolutely vital. And I think that was really one of the fundamental things when we were developing this as an assessment was the inclusion of AI in it is really quite sort of multifactorial, if you like. It is getting the students to appreciate what is out there in the world, what women are experiencing, what they're using, what they're going to perhaps bring to them. It also gets them to recognise both the benefits and the challenges of that information. They're effectively looking at it with both sets of eyes, from the woman's perspective and as student midwives themselves, and it's really encouraging them to be able to seek out what we would classify as higher quality evidence sources or academic evidence sources, to then go in and appraise that against the AI generated information. So I think the students who have experienced it have actually found that quite an empowering process, because it is actually directly showing them what they can add to the picture that a simple AI generated answer or search cannot do, which is what we're hoping for.
There's another question from Richard, and I suppose it's about, you know, how you can link your improvements to students, you know, to student progression or student success on the model to this actual intervention. Because he said, if I've got this right, Richard, I might not have had it right. He said, could the improvement in student scores, I presume, just be a reflection of massive and continuing improvements in AI?
I'm not sure that maybe, I think in response to that, the AI use that we did was only to generate the prompts. So the students were not using AI to respond to the assessment brief. So the improvement in the student scores is the students' work and effort. And what we can see marking across those two cohorts where we didn't use an AI generated prompt the first time and then we did the second time is the visibility of application and analysis is much clearer and stronger in the AI generated prompts.
I think it's important to realise that the use of AI within this assessment wasn't for the students to use it as a tool. It was at the starting point of the assessment itself and the generation of the prompts. So they weren't encouraged to actually utilise it as a tool towards their responses.
So the assessment required them to engage with AI generated output that they might come across in the context of their professional life as midwives. So helping women make sense of information that was generated through AI. So sense checking and reality checking, I guess, for some of it, because you can get some pretty incredible stuff if you use general search engines, and they all now say using generative AI on it.
Okay, yeah, really interesting. I suppose it's just, sort of, it's about getting your student to authenticate the information that the patient is bringing to you as a healthcare professional. Is that right?
Absolutely, and helping students to be really curious about what the wider web-based world was throwing up to them, because we were really aware prior to this point, our students would drop something into a search engine and go, oh, those are the important things to include in my assignment. So we were aware that it was prompting them as well, but actually we needed them to be much more critical of what it was throwing up and triangulate what it was saying. And that's why we chose topics that actually are emergent. So they would have to do that.
A really interesting way of sort of, accepting that AI is in the public domain now and being used by patients to extract information. And then, and I think it sort of talks to our principles in terms of that human element always has to be there when you're when you're a healthcare professional and you're dealing with these new tools that patients might access. So Bill is coming again. I'm going to ask Bill I'll ask Bill's question, then we'll move on to the last one, or move on to the next case study. Is how do we develop a student's criticality, skepticism, and curiosity when using AI? If that makes sense. Won't the patient expect that the nurse midwife has checked the reliability of the information they provide? I don't know whether you've got a response to that.
So I think this is about journeying together. So some of these really emergent areas, midwives are not necessarily going to know much more than the woman coming to them, but it is their responsibility to find out more. So that's what we wanted to prompt the students to be able to do, to actually say, okay, this is here. What is there in the professional literature, in the database search that I can find? What is there in terms of our professional Royal College, for example, that's giving us guidance on this new emergent thing? So you're absolutely right. The service user would expect the midwife to, I suppose, package all of that up in a planning for care way, which is exactly what we've done in the case study. But they won't necessarily know it immediately that day because things are moving too quickly.
Yeah.
Does that make sense? Yeah.
Yeah. Thanks very much. I mean, these case studies and these discussions have generated discussion amongst our group and amongst everybody else. And I'm going to thank you very much and move on to our next one, because I'm just conscious of time, but we could talk about this all day, absolutely. I'm going to hand over to Natalie, who's actually one of our subgroup members, who presented this case study as an area of best practice in pharmacy practice. And so really just talk about, how we're spanning the professions with this piece of work. So I'll hand over to Natalie from Aston University for the next presentation. Thanks, Natalie.
Hi, thanks very much, and welcome to everyone to this webinar, and big shout out to anyone who has got a School of Pharmacy in their universities. But I think hopefully all healthcare disciplines will be able to take away something for this. So I live in pharmacy at Aston University. I have a role both within my school and also the wider college that my school sits in for education provision. And the aspect I'm going to be talking about is AI and sustainability. And the project that it came from essentially was around placement and professional experiences expansion. Now, this was in response to change from our regulator with new learning outcomes that meant we needed to have a dramatic increase in the amount of placements and patient contact within our degree program. So we embarked on a placement expansion project, and part of that used AI. So we were looking to increase the amount of placements, but to support those placements in a way where we were quality assuring what we were doing for everyone and the training. And we were also trying to reduce carbon footprint and cost of what we were doing through that expansion. At the time when those learning outcomes got put in and changed, our students didn't have any access to the NHS training placement fund to support their travel. So we were quite mindful that we were doing something that would be an extra cost and an extra environment impact as well. So through our project, we were able to increase our placement partners and increase our professional experience hours quite dramatically. So we're looking at over a 700% increase from baseline. And this data is from a couple of years ago and is based on our first wave where we produced 59 bespoke scenarios to use within our curriculum. We're now up to around 100 bespoke AI scenarios within our curriculum. And within each scenario, a student is interacting with an AI character, responding as that character would with some given information that we've created. That character could be a fellow healthcare professional, such as a doctor, nurse, or midwife, or it could be a patient or patient's relative. So we were able to simulate a range of different things to help with quality assurance, of giving them a range of different things to see that they might not be able to ensure in practice, as well as obviously thinking about inclusivity. So we've got a number of different tenets of this. But with the project, we'll be focusing on the AI simulation part of what we did and looking specifically at the sustainability angle of our project. So with the sustainability focus, we're using simulations at scale. So we're using in the realms of 30,000 AI runs of a scenario within the School of Pharmacy alone. Since starting this initiative, I've also rolled it out to the School of Medicine and Nursing, who are using it in slightly different ways. But we've got quite high AI usage within our program. But using it at scale enables us to drive down the cost per simulation, which makes it sustainable when we're looking at NHS tariff and providing that experience within that kind of sustainability of that monetary framework. Our students can complete the AI scenarios anywhere. So that has reduced their travel to university if in case they were completing simulations on campus or travel to a placement location for that training. So we're lowering the carbon footprint and reducing the cost for our students as well. That was really important for us because we've also got a widening participation background to our university. And around 60 to 70% of my students each year will be from the lower two socioeconomic groups. It does also help us to reduce the burden of on-placement training for our placement providers, which means our placement providers can focus more time on delivering that service, not just having to train students at the same time. And that's what's been one of the biggest barriers, actually. And we're still in the midst of a culture shift of making every pharmacist think it's their job to train pharmacists, no matter which sector they're in, and no matter whether they've got education or not in their title, which used to be the tenet that we were working under. Our students are able to take on service roles quicker when they are out on placements, and we've had those direct comments back from our providers as well. But we are also ensuring that we're future-proofing our scenarios. So we own our simulation content. That means if a service changes, if a guideline changes, we can go in and within 10 minutes, we can change that scenario. We own all of our content. We can tweak it as we see fit. And we have long-term QA processes in. We have review points every year to make sure we're ensuring the accuracy of our content from year to year. But we have had to change content when a service suddenly changed names within the NHS service provision. But we were able to do that quite simply, and it took us 10 minutes to do so. There is some general advice, obviously, for people with AI simulation. So you need to have an end goal in mind. Obviously, you've got to use it in line with your professional body's hours. Some will have tighter regulation on this as well. And obviously, you need to make sure your product conforms to the best practice for simulation, so you're supporting your students. By knowing your product and how it acts against best practice, you can also plan your wraparound, because the sequencing of your AI scenarios is really key to your students' journey in achieving what you want them to do, essentially, throughout your building process. We also redid every single item of simulation at the same time as we wrote every single AI simulation to try and create a high benchmark for all. We're also quite transparent with our students as well around what the AI can provide for them in terms of simulation versus why we might still use campus simulation, to make them understand the methodologies of the teaching methods that we're actually using. I've tried to go through that as quickly as possible because I know that we were kind of moving quickly through time. I don't know whether anyone's got any questions. I do provide a lot of one-to-one advice for institutions who are starting out in AI. So I'm happy for anyone to reach out to me if you just want to chat in the diary about what you're doing or trying to refine it.
Thanks very much, Natalie. Really helpful. One of the questions, I've just got a question around, the sustainability side of things, and in terms of, it reduces travel to placement. Has it reduced the sort of relationships between the student and the placement areas, or indeed the relationship with the academic staff and students at all, using this type of model?
No. There's a few reasons for that. One, for our placement providers, our students are going in more prepared. So I've got people who have, say, one of our first year students, maybe they've had them for the first time on a 4-week block in community, and they said, I've had a great experience, I want more students. They then get involved in having our 3rd year students for vaccination training placements. They've told me that my first years are better than a comparator university who's down the road from me when they're having 2nd or 3rd year students coming in, because I'm investing in that training modality. So I think actually it builds our relationships with stakeholders. I suppose it's important to mention, when we curated what we were building in our first 59 scenarios, we did involve stakeholders, and I've got a number of teacher practitioners who have one foot still in practice with our placement providers, and half their time is spent with us as a university. So we were involving stakeholders in what they wanted to see in that training. So we were trying to create it also to our placement stakeholders' needs.
And one of the questions just around 59 scenarios sounds like a huge amount of work and investment in time. Did you find that using the AI was much more efficient than your previous approach to building scenarios?
So we didn't use the AI to build as such. Our faculty were curating it in terms of deciding who the character was, deciding the marking rubric, and that's put into the platform. And then it's the AI in the platform that enables individual feedback for every single student. That's different every time they attempt it, depending on their tone, voice, words they're using, etc. I am embarking on a project at the moment looking at some sophisticated prompt engineering for use with My Dispense. There's been some work already done on that in Ireland, but I'm looking at how we can build scenarios using AI with a prompting framework at the moment. And I'm kicking off that work in November.
Sounds fantastic, and we look forward to hearing more about that work once we sort of finalise the case study. So thanks very much for that, Natalie. Excellent work, thank you. I'm now going to, we're running good to time, so I'm going to hand over to Andrea from King's College London, who's going to talk about her work on upskilling faculty in the use of AI and the learning module that they have developed at King's College. So I'm going to over to you, Andrea.
Thanks, Ruth. I'll just share my screen. Hang on. Okay, so what I'm going to talk about really is our whole university approach that we have, not just within our faculty, but across King's as a whole, to developing sort of staff capacity to enable people to integrate AI into their educational activities. At King's, we've got two big AI streams, really. We are very fortunate in that we have been able to set up an institute for artificial intelligence, and that institute really leads the research streams that are happening at King's, and there's lots of different areas, sort of health sciences, informatics, digital humanities, business, this idea of big data, and then ethical and responsible use of AI by the public, but also by business and things. And then the part of the work that I'm involved in is the education part, and that's being supported by King's Academy, which is our sort of central teaching and learning unit. And what King's Academy are doing in collaboration with faculty colleagues like myself is really driving the guidance for students, and then also the guidance for staff about how we integrate AI into, particularly generative AI, into our work that we're doing with students. And at King's, for sort of education focused activities, we've sort of adopted the Russell Group principles for the use of Gen AI. And one of those is that staff should be equipped to support students to use generative AI tools effectively and appropriately to support their learning experience. And obviously, one of the areas that we've been doing a lot of work on is the area of assessment. It causes a lot of anxiety amongst colleagues. And we've been thinking really about how can we support colleagues to, as other people on the webinar have said, how can we support colleagues to support students to use AI ethically and appropriately in their academic work. I'm going to sort of focus a little bit slightly on the sort of assessment piece, but the other piece that's happening at KCL and particularly in my faculty is that we are also using AI to develop personalised learning. So we're using it to help students with their learning activities and making sure that learning activities that we generate and provide within our virtual learning environment have some of them are using personal AI to drive personalised learning. So students, when they're interacting with things on the virtual learning environment, are having questions, topics, and learning activities directed to them that are personalised to the pace and level of their own learning. So that's a sort of another piece of work that we're doing in my faculty, and we're actually doing that in collaboration with one of the publishers, academic publishers. But essentially at KCL, what we have for assessment is we have, the university has adopted what it calls 4 levels of use within assessment. So minimal, limited, open and embedded. And then there are these 3 golden rules for students. So King's, like many organisations, is taking this permissive approach to AI, so students, the golden rules we have for them are that they should learn with their chats and interaction, but they must never cut and paste, that they should ask if they're uncertain about what is allowed in any given assessment, and then ensure they take time before submission to acknowledge use of generative AI. And in relation to sort of acknowledging the use of generative AI, again, like many universities, we are implementing AI cover sheets where students have to declare how they have used AI in their assessment within the bounds of what's permissible for that particular assessment task. And I'll talk a little bit more about how we're sort of approaching that. But obviously, one of the big issues is around staff development, and how do we upskill all of our staff to be able to feel confident about how they integrate AI into their work, how they can use AI to support their own work, but also how can they direct students? Because one of the things we found, I lead what's called a library project in the final year of bioscience education in my faculty, and we have a permissive use of AI within the library projects, which are effectively literature reviews, and there has been some sort of resistance from some colleagues around how students can use AI. So it's really important that we upskill staff. So what King's has developed is a 3-week Future Learn course, and that is freely available to all staff and students, and all staff and students are encouraged to complete it. It is also available on Future Learn, and I did notice when I went into it the other day that lots of people from lots of different universities across the world have been doing the Future Learn course, and that was developed by Martin Compton, Dr. Martin Compton, who is the university lead for the integration of AI into education, and he sits within King's Academy but works across faculties with colleagues who have an interest. So, and that provides staff, it's a 3-week, as I said, course, and what it does is it provides staff with a basis about how they can use AI, not just in assessment, but also in supporting student learning. So it talks about lots of different AI tools. It addresses some of the issues around sustainability, the ethical use of AI. It there's a section on, is AI ethical in relation to, for example, the energy use that you need in order to particularly drive big AI usage and things like that. It talks about ethical use, but it also introduces staff to all of the different types of AI programs that they could use within their teaching and learning activities. The other stream of work is that we have a fully comprehensive sort of intranet pages that have staff resources with a focus on teaching, assessment and feedback. The other thing that is happening at KCL is that we have funding for education-focused projects to develop both colleagues' understanding and use of AI, but also to evaluate the use of AI within educational context. So within my faculty, in particular, we have funding to do some projects this year, one of which is looking at the use of AI in assessment feedback, so using AI-generated assessment feedback and comparing that with academic feedback and students' perceptions. We have some projects looking at using AI in simulation, which obviously Aston were talking about. And then we've also got another project where we're using AI to facilitate reflective practice with medical students, and how that can help them to develop their reflective practice using AI chatbots that we have developed and designed to support them with their reflection. And that's happening with Year 1 medical students. So we're sort of trying to embed that at the beginning of their program. And then one of the projects that I'm the lead on is the implementation of AI within literature reviews, and how are students using AI within literature reviews and evaluating their use of that within literature reviews. The approach that we're taking at KCL in relation to AI for assessment is that we are encouraging all program directors, so that's course leaders, to have a program level approach to the use of generative AI in assessment. So the idea is that across a program, students will have varied opportunities to use generative AI in particular in summative assessments. So there may be some assessments, for example, where it's not used at all, so unseen examinations would obviously be a good example of that, but there also should be assessments where generative AI is completely embedded in it and they're using it to develop their skills and knowledge. So a good example of that would be in physiotherapy. In the final year of our master's and undergraduate physiotherapy programs, students have to develop a complexity model for patients with complex needs. And one of the things we're doing is using AI to help them generate those complexity models and for them to understand how care for complex patients is coordinated and provided. And then the final part of our piece of work really is around symposia focused on educational developments in AI. So we have within my faculty what we call education cafes, which I lead, which are opportunities for staff to discuss sort of hot topics in education. And then we have regular development staff, faculty development events for, we're divided up into a School of Bioscience Education, a School of Medical Education, and we have events across both of those. So what we've really tried to do in the faculty and in the university of whole is have a sort of comprehensive suite of staff development opportunities, because I think there's lots of staff that are using AI. We have obviously a number of research colleagues that are using it. But there's also, we have a sort of, I would say there's quite a few staff who don't necessarily have the skills or knowledge and also feel tentative about using it with students. And obviously what we don't want to do is have our students driving, if you like, what happens with AI. We want to be supporting them and sort of pushing forward with it at the same time that they're using it. So that's how we've sort of embedded staff development across the university, but more specifically within my faculty around AI usage. The other thing that we have at King's, which I'll just touch on briefly, is we have this sort of pair framework that we use for working with students. And this is either for assessment, but it's also for learning. And this was developed by one of our professors in our business school. And it's really around sort of thinking about when you're working with students around sort of problem-based learning, or thinking about case studies and things that they might encounter. So the idea is that you have a problem and the students formulate it, and then they're encouraged to select suitable AI tools which could help them to sort of manage their problem or think about their problem. Then they interact with the AI tools in order to see how the AI could support the sort of answer to their problem, and then we get them to reflect on the experience. And we've sort of adopted this pair framework across the university as a whole, and it's embedded within our Future Learn course, really to give colleagues a mechanism by which they can think about how they can integrate AI within their discipline, because obviously there are nuances within each specific discipline, and we're trying to have this sort of whole university approach, but then recognize that different disciplines will be doing different things. So I'll stop sharing now.
Brilliant. Thank you, Andrea, and thank you, everybody. I think those golden rules are absolute golden nuggets in terms of what we're asking our students to do about, those 3 points that you've made. So I think that is fantastic. Kevin Henshaw has got a comment which is about the level of support and openness, and how, he feels that is really, really beneficial. And just really a statement: I encourage students to use AI, but we have increased the pass marks in some assessments and expect students to provide a short reflection on what was useful and also not so useful with the AI use. I don't know whether one or anybody has a comment around that.
Yeah, that's a really good point, I think, Kevin. And so for example, the project I'm doing with sort of literature reviews, we did want to put that into the literature review, but our Dean of Education in Bioscience said, oh, we don't want to change the assessment too much. What we're going to do is, on the cover sheet that we're asking students to use, they have to declare, have they used AI, and then what parts of the assessment did they use it for. So the plan is, and it's a large group of students, we're talking 300, 400 students, we're going to do a content analysis of those cover sheets so that we can then sort of identify how students used it. We've also provided them with a framework for their literature reviews about what tasks they have to do to undertake a literature review and what they can use the AI for in relation to each of those tasks. So it's quite a detailed guidance just to sort of set the parameters for students. So for example, they're not allowed to use AI to actually do the literature searching. They have to do that themselves. So yeah, so one of the things we're planning to do is a content analysis of these AI cover sheets.
Yeah, thanks very much. So one last question from Kevin, which is, can I ask, What is the name of the Future Learn course to support colleagues on AI use?
So it is called, and you can search for it on Future Learn. Let me just find the title again. It is called AI in Education, and it's badged under King's. And if you just search on Future Learn, you will be able to see it. It is, if I assume if your university subscribes to Future Learn, then you will have access to the course. So you'll be able to access it and do it. And it's good. I mean, I did it, you know, because I think it's always good. And it's very interactive, and it's got good pacing over 3 weeks. So yeah.
Thank you. Now, I think we could all talk all day about all of those presentations and their contribution to knowledge here, but I'm afraid we've run out of time. So it just leaves me to say thank you, first of all, to all the participants and the fantastic questions that were asked to our panel, who were Emma Mellors from Oxford Brookes, Mary Bell and Sarah Stevenson from Northumbria University, Natalie Lewis from Aston University, and Andrea Cockett from King's College London. I am sure they would be more than happy to receive any questions or queries after, and of course I am too. So please do get in touch if you've got any questions or queries. And just the final thing to say is that we're aiming for our guiding principles and case studies and report to be coming out in spring 2026. We'll do a launch of that through the Council of Deans, and we look forward to hearing any comments or feedback on those. And if anybody who's listening in has got any other case studies that they think they would like to contribute to this piece of work, please do let us know. Thank you very much all for coming.